All right. Thank you so much for joining us here at Black Girl Recovering. I actually have the pleasure right now to be speaking with Dr. Lauren McCullough with the American Cancer Society. And Dr. McCullough, I really hope you are able to talk to us about what newness that you're doing, but also kind of like share with us a little bit like what led you to want to be a
Mhm.
part of the American Cancer Society? Was there something personal, or this was something that when you, as long as you was this high, you was like, I'm going to be a doctor and this is what I want to do.
Yeah, no, really, really good question, and I think important to start off with. So yeah, was going to talk a little bit about my journey and kind of how I got to this place. Um, so I have always been interested in a career in medicine and science, and really sort of focused on that through primary education until I got to college at Vanderbilt in 2001. And my freshman year, spring of my freshman year, my father was diagnosed with lung cancer,
Okay.
which came as a shock because he was really young, only 50 years old. And he very quickly had his cancer progress and was diagnosed in March, and he passed away in September. So very
Mm,
beginning of my sophomore year of college. And so I was pre-med, and so I sat in classes, learning organic chemistry and physics and biology and all of these things, and found myself really wondering, about things that weren't below the skin, things that weren't cells and physics, and thinking about neighborhoods and thinking about different types of exposures. My dad owned a coin laundry in a very deprived neighborhood. And so just thinking about like his day-to-day interactions, what he was exposed to,
hmm.
chemicals in the laundromat, his environment, how that did not necessarily facilitate opportunities for optimal health. Some of the
Yeah.
challenges we had with seeking health care once he was diagnosed, and then generally like his distrust of the medical care system.
Hmm.
Um, and so I've spent most of my college career just in this sort of state of, well, I'm learning to be a doctor by taking all of these, biology, physics, orgo classes, but they're not really addressing some of the questions that I think were more relevant in watching my own father suffer through this disease. And so I decided to go and pursue a master's of public health, which really felt more aligned with the questions that I was asking and the things that I was thinking. And then continued my education at Meharry Medical College, and then eventually went to UNC Chapel Hill, where I got my PhD in epidemiology. So I've been a cancer epidemiologist for about 2 decades now, um,
Wow.
really focused on, trying to understand and improve health, particularly in minoritized populations. And so that's kind of what led me to this space and place. First interacted with the American Cancer Society, um, shortly after my dad passed, just kind of looking into the organization and what they were doing, and became a very young, very nominal, but generous donor.
Yeah.
And just have always appreciated the work that's been done here at this organization to support cancer survivors, as well as their families and caregivers. So that was something that was important to me and recognized very early on, as I began my career in this space. Um, and so, studying cancer in men was a little too close to home for me. And so I decided
Yeah.
to really focus on cancer among Black women
Hmm.
specifically. And so breast cancer, we know, is the highest incident cancer in the United States and emerging globally, after skin cancer. And so I focused my attention on breast cancer and now have expanded to colorectal and endometrial cancer.
Hmm.
Um, but my interest in thinking about, health equity, I think from a more global perspective, and not just, well, do you have insurance? Do you have access? Really came in 2001, so still in the pandemic, where I suddenly had an urgent issue. I had really bad stomach pain and was rushed by my husband to the hospital. And of course, he couldn't stay with me because it was COVID. And so, nobody could be around. And I was sitting in the waiting room for about an hour and overheard someone say it was about 4 hours to get to triage. And I was like, there's no way I'm going to make it for 4 hours. So crawled over to the desk, to express sort of my concern that, I could not
Hmm.
wait for 4 hours, and was immediately asked if I'd like my name taken off the list,
Wow.
as if I was waiting for a table at a restaurant.
Wow.
And I said, no, like, I don't think you understand. I'm not going to make it. And they were like, we
Yeah.
can take your name off the list. Um, and so I immediately like called my husband. I was like fetal position on the floor. He argued with the security guard to come into the hospital and pick me up off the floor. And at the
Mm.
time, I had very good relationships with a lot of clinicians at my institutional hospital. And my husband was like, you need to start calling your friends. You need to start
Yeah.
calling medical professionals, people that you know. Like, and he pulled out my phone. He was like, start calling people. And so I did, and I got rushed to my institutional hospital where, fellows and colleagues came down from wherever they were and got me out of the ER and began to do workups. And I was worked up, and they realized that I had a very rare, about 1 in a million bowel obstruction that was life-threatening.
Mm.
And they said, we got to operate in the next 2 hours. Um, and so I went from being told it would be 4 hours to triage to we need to operate on you in the next 2 hours. And so that happened
Like now,
like now.
immediate.
Yeah. And this was a surgery that, again, it's 1 in a million. So most
Yeah.
people hadn't done. So I actually had a colleague call a surgeon out of their own personal bed and say, Lauren's at the hospital. We need you to perform this surgery. So it was very fortunate that I was privileged enough to have these connections, just based off of what I do day to day. Um, and that surgeon, after the surgery was over and I was in the waiting room by myself, or in my hospital room, said in another 4 hours I wouldn't have made it. Um, and so that was really, I think, an inflection point for me, because I think a lot of times in health, and when we think about health disparities and health equity, low hanging fruit is we need better insurance, we need better access, we need transportation, we need all these things. But here I was, a doctorally trained scientist,
Hmm.
with millions of dollars in grant funding at a R1 institution with a named professorship, and I almost died in a
Yeah.
hospital because I didn't get the care that I was supposed to get. And largely because, you know, you can't hide who you are, right? I was a black
Hmm.
face,
Hmm.
and my needs and my pain was ignored. And it didn't matter that it had in health insurance. It didn't matter that I had a high income or was well educated. It was really the biases in our medical system that almost left me with a really terrible outcome. And so I sat in the hospital for 7 days after that, by myself, and really just had a lot of opportunity to think about the research that I was doing and the career that I was building. And of course, I was interested in cancer. I was always interested in minority health. But this just showed me that there are different layers to this that I think are
Hmm.
largely unexplored. And there are new data really only emerging that talk about the systems and the structural biases and the racism and the
Yeah.
discrimination that exist and persist in our healthcare system. And so I always say God has a plan. If my father hadn't passed of cancer, I probably would not be a cancer epidemiologist. If I had not had that unfortunate situation in the hospital, I probably would not have been as compelled to work on this particular study. Uh,
Hmm.
and so that really was my journey to voices and to helping build this really transformational study.
Okay. Well, can you tell us a little bit about the study? What
Yeah,
was
so
like, what's the goal?
right. So our goal is to really be able to inform health and wellness among Black women.
Yeah.
We know that for cancer specifically, Black women are more likely to get more aggressive types of tumors. They're more likely to be diagnosed at late stage. And then upon a cancer diagnosis, they have the poor survival of any other racial or ethnic group. And while we know that there are certain things that account for this, access, insurance, et cetera, a large portion of why this disparity exists is really unknown and undiscovered. And so the goal of Voices is to really better understand why Black women get these more aggressive disease and why upon diagnosis, they're less likely to live than their counterparts.
Yeah.
And we plan to do this by really seeking to understand the experience of Black women. I think that does not necessarily get captured in medical research. And I think it's so important when we're thinking about how to care for any population that you really consider the total person, right? We're not just the
Mm-hmm.
cells that make up our body. We are our experiences historically and current. We are our family lineage. We are all of these things. And so Voices really is an opportunity to look at the multi-level drivers of health inequities among Black women. And we really wanted to focus solely on Black women rather than having a comparison to white women, because as we begin to think about interventions in this particular demographic, one thing I always say is a Black woman, the counterfactual, will never be a white woman, right? I
Yes.
will never walk through this life with that experience. And
Mm-hmm.
so we need to stop assuming that the status quo is a white experience, because
Yeah.
that is just not possible. But we know that there are Black women that survive and thrive. And so to be able to look at Black women and to understand, well, why are these groups of women having poor outcomes and why are these groups of women having optimal outcomes, will help better inform interventions that I think are going to be culturally relevant for Black women.
Yeah.
Um, so the goal is to recruit 100,000 women, large number, into this study, and to be able to follow them over a long term to really understand what their experiences are day to day, their lifestyle experiences, what their neighborhoods are like, of course, experiences of racism and discrimination, and see, if we can glean any insight on why Black women are being diagnosed with, these more aggressive cancers, and
Mm-hmm.
why they're not surviving.
Wow. It is a very large study. It's like what, 20 states?
Yes, 20 states plus DC.
Awesome. Well, Texas being one of those states, and so that is why I'm so glad that you're with us this morning to share about this study. So, can you tell me the criteria, like the
Right. So,
age? Mm-hmm.
yep. To be eligible for this study, you have to identify as a Black woman,
Mm-hmm.
be between the ages of 25 and 55 years old, live in one of those 20 eligible states or DC, and not have been diagnosed with cancer except for skin cancer. So if you meet those criteria, you would just go to our website, voices.cancer.org. You would confirm your eligibility, consent to be a part of the study. We want you to know everything that's involved and that you're, well aware of the study practices and procedures. This is an observational study. We're not giving you intervention. We're not giving you a drug. We're just asking you about who you are and what you're exposed to and what you do. And after you finish that, a short registration survey, you would get your first life and health history survey, which takes about an hour to complete, and be a part of this community. We would follow up with women twice a year, so two 30-minute touch points every year just to get updates on your health or have things
Mm-hmm.
changed. You following a new diet? Has your physical activity patterns changed? Have you recently had a baby? Have you recently had a diagnosis of any health condition? Those types of questions. So we say it's about an hour investment every year to really have a huge impact on understanding the health of Black women and being able to better inform the health of Black women so we can prevent some of these awful diseases.
Okay. Wonderful. I know the enrollment opened on May 6th.
Mhm.
Is it going to be like an open enrollment?
Yes, until we get to our 100,000, enrollment will be open. Um, so if you're eligible, we invite you to at least visit us at voices.cancer.org.
Okay.
There you can see the study team. You can hear about some of the other large scale studies that have been led by the ACS. We have tons of FAQs. And so if you have questions, we definitely direct you there. And from there, you can also communicate with our research team. They're here, they're ready Monday through Friday to be able to address your questions. That way, everybody can make an informed decision about participating. But we certainly hope that Black women around the country join us because we can't do it without them.
Beautiful. Well, Dr. McCullough, thank you so much for taking time out to actually talk to us about this study, because I know it's actually going to be groundbreaking, because the focus is on us. And I
Right.
think for the first time, so I'm actually absolutely going to be sharing this to my community, getting as many Black women to be a part of this as possible. Um, thank you. Thank you for taking time out of your day. We appreciate you for doing what you do. And also to the American Cancer Society for, uh, open up doors, So thank you so much. What's one final word that you would like to leave us today?
So I'd like to say, I think as Black women, we do and we are so much. And um, this is for us. I am a mother of three little Black boys who are my pride and joy, but also drive me crazy. And it's busy and I'm always running and trying to get everybody to where they need to be. And oftentimes I think we neglect to see our needs met, and this study is a part of it. And so if you join us as you're taking your surveys, we hope that you feel seen, we hope that you feel heard, we hope that those things that you've thought about in the back of your mind as affecting your health are validated. We just want you to feel seen because we put a lot of thought into how we've designed this study, so that we can better understand, our day-to-day experiences and how that impacts our health.
Wonderful. Thank you so much. We appreciate all that you do.
Thank you so much for having me.
All right, so here I am. I know you couldn't see my face for the duration of the video, but I just want to hop on here and encourage all my Black women who may meet the criteria for this study. Please go to voices.cancer.org, and it's through the American Cancer Society, and you can learn more about this study. Again, that's Voices of Black Women, and it's at voices.cancer.org. I just want to thank Dr. Lauren McCullough for her just taking the time out of her busy schedule to meet with me, to provide some information so that I can share it out to my community in regards to this study and it's looking at Black women and health. So again, please go and check it out. And thank you so much for joining us today. All right, bye-bye.